This is Dr. Bev Knox, and you are listening to my Psychology Tutorials. Learn psychology while you sleep.
Today's lesson is all about eating disorders. It has not always done so, but Western society today equates thinness with health and beauty. In fact, in the United States, thinness has become a national obsession. Most of us are preoccupied with how much we eat as with the taste and nutritional value of our food. Thus, it is not surprising that during the past 3 decades, we have also witnessed an increase in 2 eating disorders that have at their core a morbid fear of gaining weight. The news media have published many reports about eating disorders. One reason for the surge in public interest is the frightening medical consequences that can result from the disorders. Rates of eating disorders have increased dramatically as thinness has become a national obsession. 2 leading disorders in this category, Anorexia Nervosa and Bulimia Nervosa, share many similarities as well as key differences. A third eating disorder, Binge eating disorder, will also be discussed today. People with anorexia pursue extreme thinness and lose dangerous amounts of weight. They may follow a pattern of restrictive type anorexia or binge eating, which is purging type anorexia nervosa. The central features of anorexia are a drive for thinness. People with this disorder develop various medical problems. As many as 90% of all cases of anorexia occur among females. Typically, the disorder begins after a person who is slightly overweight or of normal weight has been on a diet. People with this disorder are afraid of becoming obese, of giving in to their growing desire to eat, and more generally, of losing control over the size and shape of their bodies. In addition, despite their focus on thinness and the severe restrictions they may place on their food intake, people with anorexia are preoccupied with food. They may spend considerable time thinking and even reading about food and planning their limited meals. Many report that their dreams are filled with images of food and eating. This preoccupation with food may in fact be a result of food deprivation rather than its cause. Persons with anorexia also think in distorted ways. They usually have a low opinion of their body shape, for example, and consider themselves unattractive. In addition, they are likely to overestimate their actual proportions. While most women in Western society overestimate their body size, and estimates of those with anorexia are particularly high. This tendency to overestimate body size has been tested in the laboratories. In a popular assessment technique, research participants look at a photograph of themselves through an adjustable lens. They are asked to adjust the lens until the image of what they see matches their actual body size. The image can be made up to 20% thinner and 20% larger in actual appearance. In one study, more than half of the individuals with anorexia overestimated their body size, stopping the lens when the image was larger than they actually were. The distorted thinking of anorexia also takes place in the form of certain maladaptive attitudes and misperceptions. People with anorexia also have certain psychological problems, such as depression, anxiety, low self-esteem, and insomnia or other sleep disturbances. Finally, persons with anorexia tend to be perfectionists, a characteristic that typically precedes the onset of the disorder. The starvation habits of anorexia may cause medical problems as well. Women develop the absence of menstrual cycles. Other problems include lowered body temperature, low blood pressure, body swelling, reduced bone mineral density, and low heart rate. Metabolic and electrolyte imbalances also may occur and can lead to death by heart failure. The poor nutrition of people with anorexia may also cause their skin to become dry and cracked, nails to become brittle, and hands and feet to become cold and blue. And some people lose their hair. Now let us move on to bulimia. People with bulimia nervosa, a disorder also known as binge purge syndrome, engage in repeated episodes of uncontrollable overeating or binges. A binge episode takes place over a limited period of time, often 2 hours, during which a person eats much more food than most people will eat during a similar time span. In addition, people with this disorder repeatedly perform inappropriate behaviors, such as forcing themselves to vomit, misuse laxatives, diuretics or enemas, fasting, or exercising excessively. Like anorexia, bulimia usually occurs in females, gaining in 75 to 90% of the cases. It begins in adolescence or young adult, mostly between the ages of 15 and 20 years of age, and often lasts for years. The weight of people with bulimia often stays within their normal range, although it may fluctuate markedly within that scope. But some people with this disorder, however, become seriously underweight and may eventually qualify for a diagnosis of anorexia instead. People with bulimia may experience between 1 and 30 binge episodes per week. In most cases, they carry out these binges in secret. The person eats massive amounts of food very rapidly with minimal chewing, usually sweet, high-calorie foods with a soft texture such as ice cream, cookies, donuts, and sandwiches. Binges are usually preceded by feelings of great tension. The person feels irritable, unreal, and powerless to control an overwhelming need to eat forbidden foods. Now let's move on to binge eating disorder. Like those with bulimia, people with binge eating disorder engage in repeated eating binges during which they feel no need to control their eating. However, they do not perform the inappropriate act of purging. As a result of their frequent binges, around half of people with binge eating disorder become overweight or even obese. Binge eating disorder was first identified 60 years ago as a pattern common among many overweight people. It is important to recognize, however, that most overweight people do not engage in repeated binges. Their weight results from frequent overeating and/or a combination of biological, psychological, and sociocultural factors. Between 2 and 7% of the population have binge eating disorder. As with the other eating disorders, women with this disorder outnumber men. At least 64% of sufferers are females. Well, most of us would like to know what causes eating disorders. So let us go ahead with some explanations of eating disorders. Most theorists now use a multidimensional risk perspective to explain eating disorders and to identify several key contributing factors. Principal among these are ego deficiencies, cognitive factors, depression, biological factors such as dysfunctional brain circuits, problematic activity in the brain, and disturbances of the body weight set point. Let us review treatment options. The first step in treating anorexia is to increase calorie intake and quickly restore the person's weight. A part of treatment is called nutritional rehabilitation. The second step is to deal with the underlying psychological and family problems, often using a combination of education, cognitive behavioral approaches, and family therapy. As many as 75% of people who are successfully treated for anorexia continue to show full or partial improvements years later. However, some of them do relapse along the way. Many continue to worry about their weight and appearance, and half continue to have some emotional type of problems. Most menstruate again when they regain weight. Treatments for bulimia, however, focused first on stopping the binge purge pattern and then on addressing the underlying causes of the disorder. Often, several treatment strategies are combined, including education, psychotherapy, which is partly cognitive behavioral therapy, and in some cases, antidepressant medications. As many as 75% of those who receive treatment eventually improve either fully or partially. Similar treatments are used to help people with binge eating disorder. These individuals, however, may also require interventions to address their excessive weight. Prevention programs are becoming more common and more effective in addressing anorexia, bulimia, and binge eating disorder.